Good morning, everyone. You know me, your neighbor at 1305. I'm expecting a lot more of my friends. I don't know what's going on right now. They said they're coming. That's why I'm sorry we made you wait a little bit more. But Terri is right. Your time is very important. So I'm going to get going whether they're here or not. And I know they're going to be flocking in the next few minutes. Okay, great. I want to introduce to you my new upline, and I call her boss. He said, no.
I'm not the boss.
And she is my mentor. She's going to be taking me to the deepest part of Medicare for me to learn more. I'm in dentistry. I'm honest. I told her, Terri, I need your help in your patience and your great knowledge. And she's so patient. It's been like that for me for the last couple months now. And I'm very excited to introduce to you Miss Terri Yurek, and her insurance agency is right close to us here in Poway.
Yes, well, the office, yes, thank you, thank you. So welcome. Many of you are already on Medicare, it appears, after talking with some of you. But you may not even understand how your Medicare plan works. So I'm just going to break down all the different parts of Medicare. This is generally a Medicare 101. It talks about, you know, A, B, C, and D and all that. But it might answer some questions, and you can maybe tell a friend that we do these kind of events with Cora out in the community to help people understand what coverage they have, how it works, and that we're such a great resource here. And my office is in Sabre Springs in the 92128 zip code. I live in Forest Ranch, so it took me 5 minutes to get here. I go to the Maranatha Church, which is like 3 minutes from my house. So I love this community, and welcome. So this is going to be just an overview of a lot of things you might already know. You know, Medicare has all these little building blocks, right? Part A, B, C, D. What's a supplement? What's D? That's for drugs. So we're going to kind of just break all that down, which you may know, but again, I'm just going to go over the presentation, and hopefully you enjoy today, okay? As you know, most of you are enrolled, but there's other periods of time throughout the year where people can make plan changes and things like that, and we'll go over that, okay? So what is Medicare? Well, it's a health insurance program, generally when you're 65 or older, but some people who are disabled get Medicare under age 65, right? So did you know that a lot of those little babies in Children's Hospital are born with a disability and they qualify for Medicare? Did you know that? Isn't that amazing? So, you know, somebody might have ALS and qualify for Medicare. That's Lou Gehrig's disease, if you didn't know that. And then end-stage renal disease, very sad. That's an automatic qualification as well for Medicare, right? And most people sign up through this place called Social Security. What the heck is that? It's another government organization, right? I'm too young, yeah. All right. So people always say things like, oh, Mom, I heard Medicare doesn't cover this. I heard Medicare doesn't cover that, or Medicare does cover this or does cover that. So Medicare has a standardized list of things they cover, right? And that list generally includes anything for prevention, diagnosis, and treatment, right? Prevention, diagnosis, and treatment. Anything medically necessary, right? So I think there's a lot of preconceived notions about things, you know, oh, my friend said Medicare didn't cover that. Well, maybe they didn't qualify, they weren't really diagnosed with something that allowed them to get a particular service. But in general, Medicare is an amazing program, okay? Really is there to help you take care of your health. Now, when I'm talking about Medicare today, when I say Medicare, I'm talking about A and B, and then we'll get into, you know, Medicare Advantage, just basically what it is. We can't talk about any particular plan today because that would be a sales event, and this is an educational event today. Right, Cora? Yes. We're giving you an education, like my daddy would say, an edumacation. Right. I know. My dad said a lot of things, believe me. Okay, so original Medicare, you have Part A and B. They both have deductibles. They both have co-insurance, meaning a % of the share of cost of your services if you didn't have a secondary coverage, right? But what is Part A? Just so you know, your little red, white, and blue card has A and B. Now, many of you have a different card, right? Like it says, I don't know, Aetna or Scan or, United Healthcare. That's not what we're talking about here. We're just talking about the underlying benefits of Medicare that are embedded into your Medicare Advantage plan. Does that make sense so far? Somebody nod. Okay, great. So Medicare Part A, think of it as everything that covers you in a facility, right? In a hospital, in a skilled nursing facility, in hospice, right? Also covers home health care, right? Custodial care is not home health care. Custodial care is home care, totally different, okay? Home care is someone to help bathe you, change your bedding, help prepare your meals if you are homebound, okay? That's home health care is a nursing level of care, right? Home health care is a nursing, coming out for physical therapy, occupational therapy, changing your bandages, giving you an infusion in your home. That's home health care, and it's usually followed by a discharge from a hospital or a nursing facility, just so you know the difference. You might not have known that. Part B, think of that as everything else. Part B, everything else, right? That's not in a facility. Doctors, specialists, labs, x-rays, diagnostics, durable medical equipment like what you're sitting on here falls under Medicare Part B, right? If you have diabetes, a pump, continuous glucose monitor, that all falls under Part B of Medicare, okay? All right, and again, everything to diagnose, treat, and your prevention, all your prevention, right? All your screenings. And you're familiar with like a bone density screening, a cancer screening, right? They send you a little kit in the mail and you have to go to the bathroom in there and send it back. Has anybody gotten one of those? Yeah. It's a little cancer screening kit, right? Ew, but I mean, life-saving, right? Absolutely. All right. Part D, think D for drugs. D is always for your drugs. Medicare A and B doesn't cover medications you take at home. Medications you get at the pharmacy are not covered by original Medicare. So you gotta get your drug coverage either through a Medicare Advantage plan or a standalone Part D drug plan, right? So there's two ways to get that, and some of you might just have original Medicare with a standalone drug plan, just adding the drug coverage, and some of you may have a Medicare Advantage plan where the drug coverage is in the plan, right? He knows. You know what you got. Do you all know what you have? Raise your hand if you have a standalone drug plan. She doesn't know. You got to look at your cards, and yeah, we'll figure it out for you. But every drug plan has a formulary, right? So one plan may cover your particular medications where another one may not cover all your particular medications, right? So there's this standardized base plan developed by Medicare, and they say that the Medicare drug and Advantage plans have to be as good or better than that standardized list, right? And most of the plans are better. You know, they are better, which is great. And then you have tiers, right? What the heck is a tier, right? You have 5 tiers of medications, 5 tiers, right? Generic, that's your preferred generic, standardized general generic, then you have preferred brand name, then you have non-preferred brand name, and then you have specialty drugs for like cancer. Can you hear me?
No, there's a ringing going on.
There is a ringing. There is a ringing.
Is that ours or outside? Is it outside?
What is it? Is it this thing? We're on fire. No, just kidding. Oh, okay. It went away. Is that better? Okay, okay. So you're all familiar with that. So, you know, sometimes you'll be prescribed a drug and you'll go to the pharmacy and it might not be covered. The pharmacy might say, I'm sorry, your plan doesn't cover that. What does that mean? It means it's not on the formulary, right? But you have a Medicare right to say, ask your plan for a formulary exception, right? And then sometimes it's a good idea to maybe get a different plan that has better drug coverage for your particular needs, right? And that's always an option, you know. So each year I tell people, you know, check your medications, check your plan. You're going to get an annual notice of change in September that tells you exactly what your plan's going to look like next year. Everybody gets it and most people throw it in the trash. They're like, oh, more junk from my plan, right? Read it, super important. It's going to tell you if your drugs are going to be covered next year or not, okay? Super important. And that's what we do as agents too. We take your list, we look at your plan, and we'll say, oh, everything's covered next year. You're good to stay in this plan. Or, you know what, your plan took these drugs off the formulary. We need to move you to a different plan, right? Okay? All right, so as you know, this is how your drug plan works. Now, I'm not going to go too into the weeds because this is changing next year. It's very exciting, very exciting. So right now, this is the base design, the federal design of a Part D drug plan, and most of your plans are better than this, okay? But the standardized Part D drug plan has a deductible, $545. Your plan may not have a deductible, or it may have a lower deductible than $545 for your medications, okay? And then the government says, well, you get some money to spend on your medications. They give you think of it as like a debit card. You get $5,030 to spend on medications this year. And when it's gone, when you've spent it all up, you know what happens? You fall into the coverage gap. And then you have to pay 25% of the cost of all your drugs, right? Now that's different if you have Medicaid, Medi-Cal, and then there is no coverage gap, but for a lot of folks. So anyway, if you're getting assistance, this won't, like state or federal assistance, this won't apply to you, okay? But a lot of folks are paying a lot of money for their drugs if they have expensive medications. Do you know how quickly you can spend down $5,030 if you're diabetic, you have COPD? It goes fast. You could spend that in 3 months. Some people spend it in a month. In January, they spend it, right? And then they fall right into the catastrophic where they pay zero. But they're paying thousands of dollars those first couple of months on their medications, okay? All right, so enrollment. I think you're all enrolled, so I'm going to kind of pass over this one here, right? You're all enrolled in your Medicare. All right. And then obviously, when you're new to Medicare, you have a 7-month window to sign up for your Part A and B. I think we're not going to talk too much detail about that. People who are late signing up, they get a penalty, right? So if you're eligible for your Medicare and you don't sign up when you're first eligible, you know, if your friends are like, oh, I'm not going to sign up for my Medicare, I don't need it, I don't want to pay for my Part B. Well, what they don't know is that there's a penalty later if you don't sign up, right? Now, if you get your Part A for free, obviously there's no penalty, but sometimes people won't sign up for Part A because it has a premium. They haven't worked their 40 quarters in the United States, right? So they might have a premium as high as $500 a month, okay? And then they won't sign up. But they're still gonna have a penalty later if they, you know? So maybe they're waiting till they get their 40 quarters, but that penalty is still gonna apply. Part B, same thing.
Is that penalty a one-time penalty?
No, that penalty is twice the number of months that you should or could have signed up and did not. So if I didn't sign up for a year, I'm going to have that penalty for 2 years. The penalty of 10% of that 505 for 2 years, right? So it's super important to be timely with Medicare. You know, I think a lot of times veterans won't sign up for their Medicare. They just don't have the budget, but they don't realize there's also programs to help pay for that too, right? And that's where we come in and we know what programs and can help you qualify, maybe for the state to pay for your Part A and pay for your Part B and things like that, right? Absolutely. And then B If you don't sign up for your Part B when you're first eligible, that penalty is for the rest of your life, forever and ever and ever and ever, okay? So in every 12-month period that you could have signed up but didn't, there's a 10% penalty, okay? So 10% times $174.70, which is the standard B premium, times however many years that you didn't enroll. And that can add up. That can add up, okay? And then same thing with the drugs.
Yeah, it's true.
It's true.
My sister-in-law, her sister.
So here's the thing about drugs. Like, I have these doctors, they never want to sign up for the drug plan because, you know, they get drugs for free. They just get the samples and stuff like that, right? Hi, welcome. Come on in.
One of my best in my community.
Come on in. So if you do not sign up for Part D when you're first eligible, that penalty starts accumulating every single month. Every single month you don't sign up for D, you have a 1% penalty times the base premium, the national base premium, so about 35 cents a month, right? So if you take 35 cents a month times 10 years, that's like $45 in penalty that gets added on when you do enroll in your drug plan. So it's always important to sign up for your Medicare A, B, D when you're first eligible, or you're gonna have, you know, the government will get you, right? Right? Has the government ever got you? They get me. They get me. I always get a bill at my office for something. I don't know. All right, so most people think, oh, I have Covered California. I don't have to sign up. Or I have VA. I don't have to sign up for my Medicare. Well, you do, or you're going to be subject to those penalties. There's only 2 situations where you can delay your Medicare enrollment without a penalty, and they're highlighted here. I have an employer-sponsored plan. I'm working. I'm still working. I can delay my Medicare. Or I'm active service, right? I'm in the military. I don't have to sign up for Medicare. I've got my military benefits. And by the way, they're very good, right? Absolutely. But all these others, COBRA, CHAMP VA, retiree plan, Medicare's always primary. That means you have to sign up. Medicare's the primary payer on all these, okay, including Covered California, okay? So if you know somebody who's like, I'm not going to sign up, let them know they're going to have a penalty because Medicare is primary to all these other plans, okay? Okay?
What's the difference between
Yes?
TRICARE and
CHAMP VA?
TRICARE veterans?
So veterans are a different level. So TRICARE is an insurance from the military for people who have worked 20 or more years. It works like a Medicare supplemental policy. VA is a different insurance. You have to go on base to use your VA benefits, right? And there are special plans designed for veterans that are amazing. And I'm not going to go into the details because I can't today. But they actually have like all these amazing benefits that coordinate and work complementary with VA. Like, you know, you can get like a $3,000 dental coverage and vision, and you get the fitness membership and all the things that they're not going to get from the VA. You know what I mean? So just amazing plans. You have VA? Yeah, there's such great plans. Now those particular plans, like a lot of them exclude drug coverage because you'll still get your drug coverage from the VA. So that's how they beef up the other benefits. So in general. Yeah. So San Diego's a big military town. We got a bunch of really great plans for veterans. Amazing. So, you know, if you're still working, remember you can delay your Medicare, right? You're still working, your employer's still footing the bill for your health care. Oh, thank goodness for that, right? For as long as possible, right? But if you leave your company plan, right? You retire, you get fired, you're no longer working, you have this 2-month window to sign up for your Medicare and your Medicare health and drug plan, okay? So, but you can delay as long as you're working. I have a lot of folks who are still working because it's expensive to live in California, right? They're 73, 74 years old, still working, still getting employer coverage. and then waiting to maximize their Social Security benefit, you know, right? Okay, and here's what we were talking about earlier. You know, once you have your Medicare, your original Medicare A and B, then you get to choose your Medicare health and drug plan, right? So you can choose either getting a Medicare supplemental policy, that's called a Medigap, and you might have a friend who says, hey, oh, I have Plan F, or I have Plan G. Anybody have a friend with Plan F or Plan G? Plan N? No? That's called a Medigap. And that kind of coverage actually just becomes a secondary coverage, like TRICARE. It's a secondary coverage to Medicare, to where you're still using the Medicare network across the country, never need a referral, but it's the more expensive option, okay? And drug coverage is sold separately under this option here. On the other side, we have Medicare Advantage. That's called Part C, Medicare Advantage. Probably most of you have a Medicare Advantage plan. They're very popular, right? And your A and B benefits are actually embedded in the Medicare Advantage plan, right? So they handle all your A and B benefits, and you get your drug coverage, and you get the transportation and the over-the-counter and the dental and the vision and all that good stuff in a Medicare Advantage plan, right?
That's right. It's a very good one for me.
It's a good one for a lot of folks because, you know, original Medicare, I like to say original Medicare doesn't cover anything from the neck up. No dental, no vision, no hearing, right? Nothing from the neck up. So these Advantage plans have great benefits for all that stuff, original Medicare, and Medi-Cal doesn't cover too. All right, so, okay. So after you have your A and B, that's when you can sign up for your health and drug plan. It's the same 7-month window when you turn 65, when you're coming new to Medicare. So they call it the initial enrollment period. And I won't go into too many details. Anybody here new to Medicare needs to sign up? More information on it? Nope.
She's trying to catch up.
I will skip that.
Just turned 65.
Yeah. So again, if you're still working and you're delaying your Medicare enrollment, it's very important to know you don't have that 7-month window. You don't have that 7-month window. When your employment ends and you sign up for your B, so if your employment ends July 1st, right? Your employment ends, your group plan ends July 1st, and you sign up for your Part B or A and B July 1st, you got to match your health and drug plan within that 63-day or that 2-month window of time to add that on. There's not that long period of time afterwards like when you're new to Medicare. So it's a different window. I always say, you know what, if you're not sure, talk to a professional, right? I talk to a professional for everything. My windows, my floor, my car, my refrigerator, my paint job. I can do handyman for everything. So it's always good to talk to a professional because I'm only good at Medicare, right? And proud of it. So yeah. All right. So this year, our Part B premium is $174.70. If you're a high earner, some people are, they get the IRMA, an income-related monthly adjusted amount. So they have to pay more for Part B because the government gets their fair share, okay? So I have some clients who are paying $300, $400, $500 a month for their Part B because when they were working, they were high earners, right? Because Social Security does like a 2-year look back on your Part B premium. So let's say you inherited a property this year. You inherited a property, it puts you into this higher income bracket. Well, 2 years from now, Social Security is going to send you a letter if your income's too high and say, oh, now you have to pay more than the $174.70 for Part B. You might have to pay $300, $400 for Part B, but it's just for that year, right? That happens. It happens. So always talk to your accountant about maybe putting that somewhere where it's not considered modified adjusted gross income. And we can talk more about that if you have questions or if you think something like that's going to happen. Because generally, you'll see your Social Security check go down because your premium here went up. People think their check got cut, but their check didn't get, their amount of their check didn't get cut. Just their Part B got more expensive because they had a high earning year. Yeah, and it happens. It happens. So And then again, this is original Medicare, right? If you just have original Medicare, if you went in the hospital, you have a deductible, whether you're in 1 day or you're in 60 days. And I think I have do I have a laser pointer on here? Let's see. There we go. I forgot I had that. Look at that. Forgot I had that. The cat loves this. Does anybody got a cat?
Oh, yeah.
I just remember we used to have a cat. This was so much fun. No way. Okay, I forgot I had that. Thank you. So this is the risk of having just original Medicare without a secondary coverage, right? Original Medicare. You go in the hospital, you have a deductible, right? Days 1 through 60, it could be 1 day or 2 days. Medicare doesn't pay that. If you're in long term, days 61 through 90, it switches to a daily copay, $408 a day. Now, if you're now this is consecutive days. If you're days 91 and beyond, your copay goes way up. Now, this is just original Medicare. I'm not talking about Medicare Advantage or having a supplement as a secondary, but isn't that crazy? People have a notion that Medicare covers everything. It doesn't, does it? Like original Medicare does not cover everything. And then Medicare says, well, if you're in the hospital days 91 onward, you start dipping into these 60 lifetime reserve days. So if you're in 120 days in the hospital with just original Medicare, you run out of days. You run out of days. Now, most people are getting a brain surgery and discharged in 3 days or, something like that, right? Right? I mean, a hip surgery, probably 4 days. But, if you were critically injured, you may, I find diabetics are in the hospital a long time sometimes, months at a time, okay? Absolutely. And that's where the Medicare Advantage would come in and say, you have unlimited days in the hospital, unlimited days, right? That extra protection, right?
That's the one we have.
Yeah. And then again, drug deductible, that's going to $590 next year, by the way. Wow. We already know that. Yeah, it's crazy. Okay, what are some things that original Medicare A and B don't cover? All this stuff, right? Again, nothing from the neck up, no dental, vision, hearing, no routine foot care. Original Medicare doesn't cover that. Doesn't cover orthopedic shoes, transportation, hearing aids. And then there's always your deductibles, co-insurance, and co-pays if you just have original Medicare, right? I can't make this stuff up. I access this right here online. Same this year, right? Okay. And that's where you can get that extra protection in your Medicare Advantage plan. So this is the other product I was talking about, a Medigap or a Medicare supplemental policy. Those are sometimes difficult to obtain if you're not new to Medicare because they require medical underwriting for folks who didn't elect this kind of coverage when they were first new to Medicare. So if you're new to Medicare and you want to get a Medigap policy, there's no medical underwriting, right? You can get that kind of coverage, keep it forever. If you want it later, like when you're sick, which some people will say, oh, I need this kind of coverage because I want to go to this doctor and this specialist and so on. You have to go through the underwriting process, okay? So it's a downfall, it's a downfall. Sometimes the insurance companies will run specials and take anyone who's in their plan that's Medicare Advantage into their supplement. They do run those kind of specials to allow people to pick these up as needed, but not very frequently, okay? And then outside of that, as I said, there's no guarantee acceptance. And if you're under 65 and have ESRD, meaning end-stage renal disease, you're not eligible, okay? Now here's some differences between what we just talked about as a recap. Medicare Advantage is on the left, Medigap or Medicare supplemental insurance is on the right, right? So what do you have? Premiums vary by plan. In San Diego, most of the HMOs are zero, but some of them with richer benefits do have a monthly premium, and you can pay that through Social Security. And then the plans are different. Some are HMO, some are PPO. The value-added benefits are all different depending on the plan, right? One plan might have really great dental, but no transportation, or something like that, right? Or one plan might have, really great over-the-counter, $200 a quarter, but might have really crummy dental, you know. So it seems like there's no plan except the commercials they say on TV that has the best of everything. The platinum, get your meals, get your free this and free that. They're banning those commercials, by the way. Thank you, Lord. They really are. Yep, and then drug coverage is generally included, and then these plans generally have a richer formulary of covered drugs compared to a standalone drug plan. And then on the right, you have Medicare supplement. Those do have monthly premiums, right? You're paying for that freedom to go anywhere in the country without a referral, right? You're using the Medicare network. But they're going to be more expensive, and then drug coverage is sold separately. The most common plan is Plan G. So if someone says, I have Plan G, you know, you're just talking around the pool. I have Plan G, I have Plan F. They have a Medicare supplemental policy, right? They're like, oh, you should get one. You're like, I heard it's like $300. You know, maybe not. But they do give you that freedom, that flexibility anywhere in the US that accepts payment from Medicare. And then down here, you know, Plan F used to be the most popular plan. Let's do this. Plan F, there we go. Look at that, Cora. I know how to use my little tool. It's not available anymore for people who are new to Medicare. Right now, the most popular plan is Plan G. That was a governmental change a couple of years ago. But yeah. And then other things, of course, that are important to you when you're considering what plan's the right fit for you, right? What's going to be my monthly cost, right? What are going to be my co-pays for these services in a Medicare Advantage plan? What services are important to me? Is it the year I get surgery and I want the lowest out-of-pocket max? Or is it the year I get the best dental and get all this dental work done, right? Seems like you can't really get everything. So you kind of gotta, I talk to my clients about, you know, saying, oh, you got a hip surgery coming up, let's move you to this plan, same doctor, you're gonna have a lower out-of-pocket threshold, right? That's important, right? Or they're like, oh, I've been needing to get all this dental work done. Well, let's move you over here and get you this better dental. You can go to that dentist. And then, you know, we can always switch you again next year. You know, you have some options, right? Right, Cora?
And a lot of Medicare Advantage, really, I'm seeing with, you know,
yeah.
I'm seeing a lot of zero for seeing your PCP.
Zero co-pays?
Fees. We never had that before.
And they're going to go, and I'll be honest with you, at the end of this, there's going to be a lot of changes to Medicare next year, and I'm going to touch on that at the end of this. And obviously, your formulary. Are all your medications covered, right? Or is one of your medications like a tier 4? Like it's a higher tier, it's costing you more, right? Because if you're not getting help from the state or from the federal government to help you pay for drugs, you might be paying an enormous amount of money for medications. And you know what I discover? I'll tell somebody, this isn't even on your plan formulary. Like they didn't know, they just keep paying this amount of money for a medication, not realizing they could ask the plan for a formulary exception or get to a different plan that covers that medication, okay? So she's having a great nap. Oh, I'm sorry. Travel. Most of the Medicare Advantage plans do cover worldwide coverage if you travel overseas. Some of them have a limitation and some are unlimited. Right? Now, some are unlimited benefit amount, and it just depends on the plan. They're all different. Hi, welcome. You look too young for Medicare. I thought so. You had a question? Do you have a question? Oh, no, he's good. Okay. Well, come on in. Come on in. All right. Does anybody have any questions? I think you all have been kind of using your plan for a long time, but I want to touch on what's coming new for next year, okay? Hi, welcome.
He's a retired Marine.
What C? C? C is a Medicare Advantage plan.
That's where you are.
Yep. Part C, if I go all the way back. Oh.
We talk about it. Yeah, we have a lot of changes for 2025.
Medicare Advantage is also called Part C. Part, yeah, A, B, C, and D. The building blocks of Medicare. Yes, yes, okay. Good question, right? And a Medicare Advantage plan can include prescription drugs or exclude prescription drugs, okay? It's called an MA If you don't have drug coverage, it's called a MAPD if it includes drug coverage. Medicare Advantage Prescription Drug Plan.
If I don't use all of the A and B and so forth and C, can I just add on to my money for food?
So money for food, that's okay, so let's talk about that. So the plans that offer that, that's an SSBCI benefit.
But he's lucky. He has a veteran's, what do you call it? He has
A VA plan? Do you have veterans? So you go on base for your health care?
Yeah.
But you also have Part C.
Yeah.
Go whatever.
I gave you the
Whatever. Are you available? And I go there.
Uh-oh.
Let's talk about you.
Because some people, and in America, everyone is so busy. Oh, I'm full of maybe next
Okay.
month. So that's why I have my veterans. I have A, I
Right.
have B, I have C.
C is a Medicare Advantage plan. So you're enrolled in a Medicare Advantage plan. Okay. And you can use that. It's complementary. So food, so there's certain benefits, just so you know, I'll give you an overview. There's certain benefits that are qualified as SSBCI benefits, meaning you get Medi-Cal and you're chronically ill, or you're chronically ill. You have a chronic diagnosis, okay? And the plans have to verify certain information about you to qualify you for the food card, the flex card to pay utilities, things like that, right? That's called an SSBCI benefit, okay? And the qualifications are a little bit different across plans, but generally there's a list, right? You have a certain condition. Sometimes food insecurity is one of those conditions. And if you attest to having a food insecurity with certain plans, you can get a food card, okay? But in general, most people don't qualify for the food cards and the flex cards, okay? Okay? So we have special plans called dual special needs plans for people with Medicare and Medi-Cal. And we have chronic special needs plans called CSNPs, CSNPS, chronic special needs plans for people who have chronic conditions. Diabetes, cardiovascular disease, Alzheimer's, right? And those conditions will qualify you for those extra benefits, right? They just may not be in your particular plan, but we have particular plans called CSNPs and DSNPs, okay? And Core's learning about all this. Right, San Diego is just a wealth of plans for people with chronic diseases and people on Medi-Cal. Those benefits are available for you. You just have to talk to somebody about, instead of trying to go online going, I want a food card, and then all this junk shows up, right? Try Googling that. Food card for Medicare. Like you're gonna get a bunch of bozos that are gonna call you if you fill out a form and your phone won't stop ringing, and before you know it, you're enrolled in a plan and you don't even have your same doctor. So don't do that. Don't do that, okay?
That's happened to him.
It happens.
He has 1,000 calls. And I said,
Once you fill out that form, you're doomed. You're doomed. Don't do it. Don't do it, okay? Okay, but good question. But yeah, there's a lot of information. Yes, I know you. You came to my office. How are you? Is this Mary?
yes,
Yeah,
Terri,
yeah,
Terri?
yeah. Nice to see you again, Mary. Yeah.
How long have they been doing making it like specialized for diabetes and stuff like that?
So actually, that was passed under the Trump administration. So that was a while ago, where they, a lot of people with chronic conditions can get like the air purifying filters for their house. They can get pest control. There's a whole bit, like dog watching if you're in the hospital. There's a lot of different things. You just have to qualify for those benefits, yeah. So your government's trying to take those away right now. Your benefits are going to change next year, not drastically, and it's going to depend on the plan, but this isn't bad news, this is realistic news. So the Medicare program has taken cuts that they cut to pay the Medicare Advantage plans for the past 2 years. This will be the second year. So when you get your annual notice of change this year, pay close attention. That's going to come to you in September. And there are a lot of plans that have formally stated that their co-pays are going to go up, their out-of-pocket max is going to go up, and the drug plan is being completely revamped next year, which means it's going to be tighter restrictions on getting certain medications, more prior authorizations, more step therapy. Now, That was all under the Inflation Reduction Act that passed in COVID, okay? Which it did a lot of good things, but it also cut the Medicare program. But it did make Part D better for you, but it's gonna, because of this change under Part D, the plan has to take full responsibility for all of the drug costs, where that used to be a shared responsibility with the government. So not only are the plans taking a pay cut, they also have to pay for all the medications, okay? So just pay close attention. You're gonna see your plan change next year. Do pay attention. They said that 90% of beneficiaries are gonna shop their plan this year, so it's gonna be crazy. I'm like, no. And I'm not making this stuff up. We've been training on this all year long and more to come. But the good news is, if you are paying for expensive medications, this is the first time in history, starting next year, that there's an actual cap on Part D. They're actually capping it. Remember the screenshot earlier that had that $8,000 true out-of-pocket max? That's changing to $2,000, okay? Now, if you get assistance, you don't feel that heat, but a lot of people do. A lot of people are feeling that heat for you know, chronic illnesses, and they have to choose between food and medications, and it's a tough call. So this is great. But what it's going to do is it's going to raise premiums, it's going to put a cut in benefits, it's going to do some other things that, depending on the plan and how big the carrier, how big the plan is and how much financial stability they have, of what's going to happen to your benefits, okay? So, and don't let that scare you. This is a good thing for a lot of folks. I love this, but I do see big changes coming because of it, okay? And so this is called the newly defined benefits. So next year, the way the drug plan is going to work is, if you have a deductible, you'll have to pay for your medications before you've met your deductible of $590. And then you'll have spending, like co-pays or co-insurance. You know, like right now you go and you pay a co-pay for a medication. You'll pay co-pays, and your out-of-pocket maximum, once that hits $2,000, everything goes to zero, right? Everything goes to zero. Amazing. Never had a cap on Part D in all of Medicare's history. So this is amazing. And I don't know if some of you remember, you might be old enough, some of you, I don't know. But back in the 90s, Medicare Part D went away for a short period of time in the late 90s, where there was no D, and then they revamped the Part D program. Yeah, but it's kind of crazy. Are you leaving us? Okay, okay. So essentially you'll have, if your plan has a deductible for drugs, you'll pay your deductible. You'll go into your initial coverage, means that's where you pay a copay for your medications. And then when you hit that out-of-pocket cap of $2,000 that you've spent, including your deductible, everything goes to zero. That's a big deal for a lot of folks, okay? It's a big deal. And one thing I want to talk about that's huge is this Medicare prescription payment plan. So you're going to get a letter along with your annual notice of change, and it's going to talk about the M3P program. M3P, the Medicare prescription payment plan. They call it M3P. What does that mean? Those folks who have high drug costs, maybe they meet their drug costs, they got to spend $2,000 in January, right? There's a payment plan, so you can sign up for it when you get that letter in the mail if you have high prescription costs. And what they'll do is they'll take that $2,000 out-of-pocket max, and they'll send you a bill for $167.77 every month, so you don't have to pay the $2,000 all at once, right? And obviously, if you're taking generics and you're paying a couple bucks a month, it's not going to, you're not going to sign up for the program. But you can sign up anytime during the year. Let's say you go to the pharmacy and you're like, oh my gosh, this new drug is $5,000, but I've got to pay $2,000, right? Because I haven't, I've only gotten my generic statin. You can sign up for the program immediately. They'll take that $2,000 and they'll break it down into payments for the remaining months of the year. Amazing, right? Right, so if you only have 6 months left of the year, they'll take that $2,000 and they'll break down those payments for the remaining 6 months. So it's not such a hardship to folks, right, to get their medications. It's called the M3P program. You'll get a letter how to sign up for it with your annual notice of change. Okay? Awesome. Thank you. You're welcome. So that's how it works. That's just the details. The option to pay out-of-pocket costs and monthly payments spread out over the year. And there'll actually be 3 ways to sign up. So if you stay with your plan next year, they're going to send you that letter to sign up. You can call and sign up, you can sign up online, or you can fill out the form and mail it into your plan and sign up for that program, okay? So they're going to give you all of that. And we're going to be doing some presentations later this year in September too about what's coming next year in more detail. This is like a really big deal for us. I mean, I'm just saying, for us, this is a really big deal, right? Oops, sorry. Yeah. Now, this is also new next year. So remember, we're talking about all these great benefits you get in your plan. So I'll call my clients and I'll be like, well, did you use your vision benefit? No, I've been meaning to go do that. I've been meaning to get that eye exam. Well, did you get all that dental work? No, we've been traveling a lot this year. And you forget the benefits that you have in your plan, right? Yeah. Now, next year, they're going to be sending a mid-year letter, and it's going to be specific to you. So it's going to say, Cora, did you know you've only used $500 of your $2,000 annual benefit for dental? Here's how to use it. This is your vendor as a reminder. If you don't have a particular dentist, give us a call. Here's a phone number, right? Right. That's or, nice. Cora, did you know you haven't had your eye exam this year? Your full vision benefit is available for you between now and December. It's going to be called a mid-year notification letter. I love this. I love this. So they have to... or we noticed you haven't used your over-the-counter credit this year at all. Did you know if you don't use it, it expires? Some plans it rolls over each quarter, some plans it doesn't, right? And they'll say, you know what? Use up that benefit. It's been accumulating. You have $400 in there, Cora. Get in there and order it. Yeah, you have a rollover on your OTC, right? So this is great. I love this. So this is coming out next year too, and I absolutely love this, They kind of do my job for me now. That's why I love it. It makes my job easier. I'll just be honest, right? And it's not more expensive to work with an agent, I'm a professional. I've been doing this for 20 years. I'll come across people who are like, I just need you to help me, but I don't know if I want you to, sign me up. I'm like, why not? Well, I don't know. I got to pay you. I'm like, no, you don't have to pay me. Well, are you legit? Yeah, I have a license. I'm certified. People get scared. I don't know. They get scared of using an agent or something, They do. And you're like, you know what? You know how I get paid? I get paid from CMS. They have a set commission that I make. It doesn't differ. Doesn't differ what plan I enroll you in. I don't get paid on one plan more than another plan. I get the same commission. So you know what? I'm a broker. I show you all the plans, right? You want to work with a broker, someone who shows you all the plans, not, you call one plan on the phone, they're going to be like, we have everything you need. Let's sign you up, right? Let somebody shop your plan. Let them look at your drugs. Talk about your needs. Do you need glasses? Do you need hearing? What's important to you this year? Because again, not every plan has every benefit, a platinum benefit. That doesn't exist, right? Doesn't exist. Maybe it's your year to get dental, Cora. Let's get you that PPO, that plan with the PPO dental. You want to see this dentist. Let's do that this year. And then in the fall, if you want to, get a different plan, we can move you again.
Which I'm really doing. Do it.
Right, exactly. So, yeah. And then that's it. Woo! So, thank you, Cora. Cora is your friendly neighborhood Medicare agent. And now it's yappy hour with lunch and lots of yapping. So talk away and thank you.
Thank you so much.
You're welcome. You're welcome.
I'm so glad she gave me her time. Yes, very busy.
It's fun.
Place, but here she is with me.
Yeah, it's a good time.
I just want to show tears, she's really great.
Yeah, you're welcome.